Thank you for joining Consumers Health Hub. Today's topic is healthcare consumerism. Yes, healthcare consumerism. I'll explain to you in detail what this is all about. This is Consumers Doctor, Dr. Bengala. Healthcare bill we just passed. It's not really about healthcare. It's all about freedom. It's all about freedom. Yes, as Abraham Lincoln said, this country will never be destroyed from outside. It will be if we falter on freedom because we destroyed ourselves. Yes. Consumerism. What is consumerism? It is an empowerment to a consumer. Consumerism is a fundamental, our entire system is based on consumerism. We excel in free enterprise market principles. Healthcare has not been a quota for the consumers because they never had the control. Consumers never had the control. Consumerism is not about deductible plans, cost shifting, and even health savings account is not about all that. Consumerism is an approach to healthcare. That's a strategy of empowering the consumer. That's the strategy. It has two basic principles. First, it has to cover the sickest of the sickest, including the healthy. Number two, it must work for those not wanting to get involved in decision making. It has to work for that group. That's only when it works. Consumerism is built on basic mega trends, so-called mega trends that affects many parts of our society. They are personal responsibility, number one. Number two, self-help and self-care. And number three, individual ownership. Number four, portability. Number five, transparency. And number six, last but not the least, is the empowerment. Those are the mega trends. Healthcare consumerism is not about transforming the health benefit plan. It is about transforming the health benefit plan into what you call as economic purchasing power. Decision making in the hands of the consumer. That's what it's all about. It's all about supplying the information, providing the right tools, along with financial incentives, rewards, and other benefits. Consumerism is transformational. Yes, it is transformational. It changes the process of cost control in healthcare from the current managed care supply control to a system called demand control. Managed care is a supply control, whereas it will transform into a a demand control by a consumer. Consumerism is about transforming a health plan from being a benefit to being an accumulating asset. Accumulating asset, yes. Consumerism must offer solutions to the expanding individual ownership of health insurance. Ownership of health insurance. You need to get this. It has to address number of the uninsured, establishing consumer-centric Medicaid, consumer-centric Medicare. These are all under the government subsidy program. The other 200 million employer subsidy program, it also has to address the employer subsidy program, employer-based, 200 million large and small firms, and it has to cover the individual, family members, and healthcare consumerism will transform itself because consumers demand it. It's a demand. What I see is Americans want freedom more than anything else. They don't want a control. They don't want somebody to tell you where to go, what to do, which doctor to see. They want freedom. They can choose. Americans knows what is best for them. In 2018, we spent $3.7 trillion. We ranked 39th among the most advanced countries in the world. That's not acceptable. We need to be number one because we are good at consumer-based personal healthcare, personalized healthcare, having personal care accounts. That will lower the costs of the healthcare. We will be number one again. I would like to see America be a number one healthcare provider, excel in it. As Ronald Reagan said, America could be a shining city all over again. Folks, if you like the channel, do subscribe to the channel, make some comments, and also hit the notification button. I'll keep appraising you about the healthcare system in America. Thank you for joining.